Thank you, Madam Chair, and thank you also, Ranking Member, for allowing me to weigh in. Um, this this issue speaks to a really important issue in rural America, not only in Arizona but throughout America. And school-based health centers provide a wide variety of essential health services to students and their families, many of whom lack health insurance and otherwise would have no ability to see a medical provider. School-based health centers can treat acute conditions like sore throats or earaches, chronic conditions like asthma, and provide preventative services like immunization and physical examinations. School-based health centers play a critical role in providing care to children and families throughout Arizona. In fact, according to the Arizona School-Based Health Alliance, 45% of school-based health centers are located in rural areas. Rural America already is suffering from a lack of access to high quality and affordable health care. Additionally, 82% of the children who use the services are uninsured. That is why School-Based Health Centers Reauthorization Act of 2019 is so critical. I fear that if Congress fails to act, many children will lose access to the important services provided by these centers. The COVID-19 pandemic has exposed what those of us in rural America already know. Many of us lack affordable access to high-quality health care. In particular, I am concerned about the mental health care of students and families whose lives have been upended and whose social structure has completely changed in light of COVID-19. Dr. Boyd, thank you for your testimony here today and for all the work that you and your members do. Uh, in our testimony, you talked quite a bit about the importance of reimbursing mental health of our students and remembering it. What changes have you and your members already seen in the mental health of our students given the COVID-19 situation? Also, what are the long-term health and educational consequences of these sort of mental health issues? And whether the students are going to go back into schools or stay home and do it virtually, this is having a profound impact on students across our country. Dr. Boyd?
This is a great question, Congressman. We're in process of putting some polls in the field, but it's very, very difficult. As I said earlier, there are estimates that could be as many as a third of Title I students people haven't heard from. And so knowing exactly what's happening in those households, we don't know. We're hopeful that as schools come back online, after this summer break, that they will be able to give us more information. Our fear is that we may lose a number of school-based health centers because their sponsoring agency does not have the resources for them to reopen. The impact, we believe, along with our colleagues in the school psychologists and counseling areas and the nurses, are going to be devastating. And students are going to be typecast when they come back and they show behaviors that to a student going through trauma is actually normal for a person going through trauma, but because they're acting out may then get typecast and put into the system. That's a problem that we're really, really concerned about. And I don't think anybody at this point has good solutions to it. But we just frankly don't know what's happening with a lot of kids at home. And that's where the telehealth opportunity is great. And support from the FCC would be great to provide those kinds of platforms and resources to get out there and find out and communicate with the kids.
Thank you, Dr. Also, are school-based health centers equipped to serve as COVID-19 testing sites?
They would be if they had access to the test. Yes, sir.
Okay. Madam Chair, I yield. Thank you.